A woman said she was forced to have complete pelvic reconstructive surgery after her doctors ignored her diagnosis for nearly a decade. Monica Eryn Johnson, 40, a New York-based beauty entrepreneur, advertising producer, and pianist, said she first began experiencing symptoms several years ago, but she chalked them up to changing hormones. "I was constantly fatigued and experienced bloating, bladder abdominal pressure, and hormonal changes like breast soreness, along with an inability to lose weight despite my efforts," she told us exclusively, adding that her periods had also become heavier. Johnson said that it wasn't until the symptoms became impossible to ignore that she knew something wasn't right. "I had chronic localized pain on my right side that felt like an intense, trapped gas bubble that wouldn't dissipate. As things progressed, I began experiencing severe abdominal and pelvic pain, cramping, burning sensations, heavy bleeding, and ongoing fatigue. At times, the sharp shooting pain was so intense it would wake me up in the middle of the night," she said. Johnson's symptoms coincided with an egg freezing consultation she had scheduled in early 2023, during which she said a fertility specialist informed her she had uterine fibroids. However, Johnson said her concerns were ignored when she visited her regular OB-GYN for further evaluation. "My primary OB-GYN, the doctor I had trusted since college and the same office I was born, trusted by my family and the community, dismissed my symptoms and brushed off my concerns, saying they weren't sure what could be the cause," she told us. She said she pushed for further tests as the pain became unbearable, and an ultrasound ultimately confirmed that she had multiple fibroids, including one the size of a grapefruit. Yet, the nurse who called with the results, she said, told her she was fine. "I was told it wasn't a big deal and that I shouldn't worry. There was no plan, no follow-up, just a quiet dismissal that left me navigating some of the worst pain of my life on my own," she recalled. Johnson's symptoms escalated within weeks, and she was forced to undergo an emergency myomectomy, which is a surgical procedure used to remove uterine fibroids, with another doctor in the same practice in 2024. "My stomach had become severely distended to the point of looking several months pregnant, and the pressure was so intense it felt like my stomach was on the verge of rupturing," she recalled. Even after surgery, Johnson was still experiencing debilitating pain, and so she made the decision to schedule an appointment with a new doctor, which led to the help she desperately needed in October 2025. The new doctor took the time to truly listen and understand every symptom I was experiencing. Without hesitation, they asked if I had ever been tested for endometriosis and recommended a laparoscopic diagnostic procedure to get to the root of the cause, neither of which had ever discussed with me or performed before, Johnson said. The findings from that procedure not only revealed that Johnson had endometriosis, but her condition was far more serious than expected and would require the expertise of a pelvic surgeon. Johnson turned to AI to help her research surgeons and ultimately found the exact specialist for her needs. "Once I found a specialist, I learned they were one of very few surgeons equipped to handle a case as complex as mine, which ultimately required complete pelvic reconstruction," she added. Things moved quickly after her endometriosis diagnosis, and she underwent surgery within 8 weeks at the end of 2025. Now, Johnson said she is taking a beat to recover from the years-long ordeal. She also said that learning about her endometriosis diagnosis, along with the potential fertility issues that can come along with it, also requires some emotional healing. Being told that you might not be able to have children naturally, and shockingly learning that your body changed in the worst unimaginable, unexpected ways, takes a real mental toll, especially when you're doing everything possible to keep your body healthy and are diligent about annual appointments, she said. What's more, Johnson said she has been dealing with her original doctor, who she claimed had technically known about her uterine fibroids since 2016. I recently had the opportunity to review my medical records, and that's when I made the shocking discovery that my original OB-GYN had documented that I had fibroids as early as 2016, but never disclosed it to me or provided a plan of action moving forward, she said. Realizing that this had gone unaddressed for years and likely worsened over time was incredibly difficult to process. I literally went through what felt like every stage of grief: shock, denial, anger, and depression, before eventually coming to terms with my new reality and finding a sense of hope and purpose again. For Johnson's advice for other women who feel like they are not being taken seriously by their own doctors: as women, especially Black women, our health concerns are so often dismissed, minimized, and gaslit. My advice to anyone going through something similar or any health crisis is don't wait. Go get checked and trust your gut if something feels off. Your intuition is there for a reason. Advocate for yourself relentlessly until all options have been exhausted. Get multiple opinions, do your research, ask questions, and never be afraid to push back. Don't ever give up on you. You know your body best.